Parkinson disease PD. It is an incurable but manageable disease. Usually the age of onset is after 60 years. More occurrence in the male gender as compared to the females. There is a progressive chronic degenerative process in the neurons that produces dopamine. Dopamine is a neurotransmitter chemical which is essential for the passage of the current produced in the neurons through the fibers of the neurons into the other groups of the central nervous system. So there is production of Lewy bodies within the neurons which are located in the substantia nigra, which is present in the basal ganglion of the central nervous system. These bodies, they consist of abnormal protein that produces destruction in the neurons which are meant for the production of essential chemical dopamine. So dopamine is a responsible chemical for the maintenance of the movements of the various movements of the human body. The etiology is genetic. There is family predisposition. There is abnormal mutation in the genes of neurons in the substantia nigra group, due to which the DNA is changed from normal to the abnormal state, and that produces the Lewy bodies or the abnormal protein responsible for the destruction of the substantia nigra, normal functioning neurons. Environmental conditions, mostly the toxins, pesticide, herbicides, these factors are usually present in the countryside area. The farmers use the various chemical and agricultural chemicals, and they are more exposed to these toxic chemicals, and they may, after a prolonged period, after several decades, they may produce this Parkinson disease. The symptoms of that disease is divided into motor and the non-motor ones. There is typical pill-rolling tremors at rest, led by rigidity in the body. There is imbalance and the abnormality in the posture, that is stooping of the body, more prone to falls. There is imbalance, vertigo, tinnitus. The person cannot keep his normal balance and may fall during his usual walk. There is slowness in the movements. Almost all the normal functions, they are slowed down due to lack of dopamine. There is deficiency in dopamine. There is loss of smell. There is slowing of the swallowing, drinking, walking, and also the cognitive processes or the capacities and abilities, they are also decreased. There is hallucinations, delusions, depressions. So this is all these phenomena is called as bradykinesia. Overall, the movements of the body in the various parts or organ, they are decreased, they become sluggish, they are slowed down. Now the diagnosis of the disease is evident from the history of the patient and the physical examination of the healthcare provider. It is quite evident from the signs and symptoms of the patient. However, there is also chances of other diseases which are similar in signs and symptoms to this PD. So we have to explore those pathology by MRI, PET scan, CT scan. So these imaging processes are performed to exclude the damage, fracture, tumors, and the hemorrhages or hematoma in the central nervous system. Now there is treatment of the PD. There is no permanent cure and treatment, but we can lessen the symptoms and severity of the symptoms in the patient. The mostly and the timely honored treatment is Sinemet, that is levodopa and carbidopa combination medicine they are used. These medicine crosses blood-brain barrier, and they are converted into the dopamine. So they fulfill the deficiency of the dopamine, which has been decreased due to the diseased substantia nigra neurons. So they overcome and normalizes the slowness or the bradykinesis process, and they normalize the movements of the body. As it is a lengthy procedure, lifelong treatment, so it has certain side effects not only in the central nervous system but also in the other parts of the body. So to overcome those side effects, we use dopamine agonist medicines, apomorphine, etc. So these medicine, they enhances the action of these medicines, levodopa, and also mitigate or lessen the side effect of these medicines. Now, if with the passage of the time, as it is a chronic disease, so there is progression in the severity of the signs and symptoms. So, to maintain the normal function and the life of the patient, finally we have option of surgical intervention, that is deep brain stimulation by the artificial electrical voltage. So there is a electronic generator device is fitted or installed under the skin, and through the wires it is connected with the electrodes which are inserted in the area which is producing the dopamine, but now that area has been diseased. So these electric currents, they destroy the Levy body, they check the further destructive process, it save the normal remaining neurons of the substantia nigra which are producing the normal quantity of the dopamine. So in order to save the healthy neurons which are meant to produce dopamine, these currents, they destroy the Levy body or the diseased body. So it also lessens the slowness in the movements. The process of dyskinesia and bradykinesia, that is also lessened and mitigated by the deep brain stimulation voltage process.